How can you prevent wound dehiscence after suture removal? Imagine your body as a delicate fabric that needs time and care to heal properly after surgery. Once the stitches are out, it might seem like the hard part is over, but the healing process continues. Wound dehiscence is when the surgical incision reopens after stitches are removed, which can happen if the wound isn't fully healed or if it's stressed too soon. Preventing this complication is all about gentle, attentive care during the healing phase. First, it's important to avoid putting strain on the wound area. Even after stitches are gone, the skin and tissue are still fragile. Refrain from lifting heavy objects or doing strenuous activities that increase pressure on the wound. For example, avoid lifting anything over 10 pounds for at least a week or as your doctor advises. When you cough, sneeze, or bend, support the area with a pillow or folded towel to absorb some of the pressure. This helps keep the wound closed and reduces the chance of it reopening. Keeping the wound clean and dry is another key step. Follow your healthcare provider's instructions carefully for cleaning the area. Usually, gentle washing with soap and water is enough, and you should pat the area dry with a clean towel. Avoid soaking the wound in water or swimming until your doctor says it's safe. Proper hygiene prevents infections, which can weaken healing tissue and cause the wound to open. Stick to your doctor's post-suture removal instructions closely. Attend all follow-up appointments so your provider can check how well the wound is healing. They might recommend specific dressings or topical treatments to support healing. If you notice any signs of trouble, like increased redness, swelling, or discharge, contact your healthcare provider immediately. Good nutrition also plays a big role. Eating foods rich in protein, vitamins, especially vitamin C, and zinc helps your body build new tissue. Drinking plenty of fluids keeps your skin hydrated and supports healing from the inside out. If you have underlying health conditions like diabetes or vascular disease, managing these conditions well is essential, as they can slow down healing. Avoid smoking and exposure to secondhand smoke. Smoking reduces blood flow and oxygen to your tissues, making healing slower and increasing the risk of wound breakdown. If you're a smoker, consider quitting during your recovery period. Gradually increasing your activity level is beneficial. Start with light walking or gentle movements as your doctor recommends. Moving around helps circulation, which supplies nutrients and oxygen to your healing tissue. But always listen to your body and avoid any activity that causes pain or tension around the wound. Finally, keep a close eye on your wound. Watch for signs like redness, swelling, increased pain, or any opening of the incision. If you see any of these, contact your healthcare provider right away. Early intervention can prevent more serious problems. By taking these steps, protecting the wound from stress, maintaining cleanliness, following medical advice, eating well, and avoiding harmful habits, you can greatly lower the chances of wound dehiscence after suture removal. Proper care ensures your incision heals strong and healthy, helping you get back to normal faster.